What's up, everybody? How we doing? I am Dr. Hoffman, the owner of the Chicago Dental Studio and the head dentist. And I like to spend some time reviewing specific cases, and I like to do this for a few reasons. One is for the patient. You might be looking to getting some sort of specific procedure done. You want to know a little bit more information about it. Maybe you've had some consultations, maybe you've been told different things, and you really don't know which way to approach it. Also, for any doctors or dentists that are getting started in their career or ones that are just continuing to learn, I'm hoping I can share some of this with all of you guys to help, because that's what I love to do. The first case I wanted to go over specifically is a conversation about a single unit tooth. And what I mean by that is a patient comes in, they had a fall or they had some sort of accident where they had broken a front tooth. The doctor did some sort of treatment, but as they've gotten older, they're just not happy with how it looks. And a lot of times it doesn't match, it's darker, etc., etc. The patient is told by other doctors and dentists that they have to do more teeth, otherwise it won't match. I would say that that's false, that there is a way that you can take a single unit case like this one and come up with a product where the results are seamless and you can't see the difference in the teeth. It's important to understand that in order to pull off results like this, you have to have a team and technology. And specifically, I want to go over a couple things, because at the end of the day, it's not just about the dentist. It's also about that dentist having the best product, the best team in order to execute, especially when it comes to matching one tooth. And so the first thing I would tell anybody is to make sure that you have really great camera technology. Not only do we have a macro lens, but we also have specific kind of soft lighting, helps break the flash off, which is what we're using to communicate the color to our team. A lot of times, if you don't have a really good camera, there's a few things that will happen. Number one, the color will get washed out. It'll look really bright because of the flash. Whoever's designing the ceramic won't really have a good reference as to what to match. Secondly, it's about detail and quality when you get up close. And if you look at the quality of this camera, you'll be able to really get a representation of what that tooth looks like. I would sometimes argue that this is almost better than real life. Sometimes I'm using photos to reassess and reevaluate, and I've had patients come in with unhappy teeth and they're like, I had to go to the lab, and I went to the lab and they picked the color and they still didn't get it right. I think photos and photography is better. But also you have to understand the lighting and the tone. If your rooms are very warm or if your rooms are very bright, that can actually also throw off the color, and then that might give you a misrepresentation of what they're trying to match. What I would suggest is making sure you have as close to like basically neutral light as possible in your operatories. Natural light is the best. So if you can have windows in your operatories, things like that, that is always going to be the best. I would say you really focus on your lighting, the lights in the ceiling. Even then, if you still feel like the color isn't exactly the gradient you want, there's a polarizing filter that you can actually put on the lens and then take the image, eliminates any like glare that the lighting might cause. And that's a really, really nice tool for you to have, especially when you're doing single teeth. The second thing that I think is super important is the ceramist. The level of detail and the customization that goes into designing a smile, but especially when it's one tooth, you have to have a specialist that creates this ceramic, because at the end of the day, we get the ceramic as a product and then we have to put it in the mouth. I can't emphasize to patients and also to up-and-coming dentists that you have to have a skilled master ceramist doing your work. I have a ceramist that works for me and we do all of our cases together. A lot of doctors don't have ceramists and they use dental labs, but in my opinion, labs are a little more cookie cutter. If you've been told as a patient you have to do more teeth to get it to match, I would say that's probably because they're using a lab and the quality and the skill of that lab can't give you the product that you want. That's super, super important. My work is customized to what I think looks best for my patients, and I'm a big fan of natural enhancements, and I don't like the one-size-fits-all fake. Some patients might want that, and that's great. Do your research and make sure you find someone that you like, and then you can ask these questions. How are you matching the color? What type of photography do you use? Do you have a camera? Can I see it? If you're gonna do an enhancement and it's your smile and it's supposed to last 30 plus years and you want it to look right, I highly suggest that whatever team you decide to work with has their own master ceramist. If you're an up and coming doctor and you're kind of learning and kind of wanting to get into cosmetic dentistry, these two things, a really legit camera system and a master ceramist, is really what you're gonna need to give the results that will like make you proud of the work that you do and also make your patients really happy.